and to shed further light on these new shipments of the vaccines that Egypt has received from China at the early hours of Tuesday. We're joined over the phone by Professor Dr. Gamila Nasr, Professor of Cardiology at Suez Canal University. Good afternoon, good evening rather. Thank you for joining us, Professor.
Hello, how are you?
Thank you very much.
All of you, and we hope you are good evening. I'm Gamila Nasr.
Yes, I know. Thank you very much for joining us, Doctor. Now, speaking of the, if you can hear me.
With you live.
Yes, we are live, actually. Thank you very much for joining us, Doctor. Now, and I'm Yasmin Bakir, the presenter, and you are actually live. Now, I was going to ask you about the vaccines that have been received, second shipment by Egypt, and who's eligible for taking these vaccinations at this stage?
Yes, this is a very good effort of the Egyptian government. You can see that it was stated that the citizens will be able to begin registration to receive the coronavirus vaccine and starting within beginning the next step in the country's vaccination campaign. And of course, as we know, that the priority will be according to government's previously announced vaccination plan, and will be given to the elderly and those suffering from chronic diseases. We all know that the Health Ministry of Health have launched a website earlier here for citizens to reserve the doses for a coronavirus vaccine, and those who will register on the website will be receiving the text message indicating the time and location for receiving the vaccine. Of course, as we know that Egypt has started its coronavirus vaccination campaign in late January by vaccinating the medical workers and the health professionals and quarantine officers using, of course, the Chinese Sinopharm vaccine. And as we know, that Egypt also will see a big shipment of the received already. As we know that yesterday it received around 300,000 doses of the Chinese vaccines, and this is, of course, will start, as a gift from China. This is very good. Also, it will receive millions vaccine doses that is developed by the Swedish pharmaceutical AstraZeneca. This will be, of course, officially received the batch of around many doses of the Sinopharm vaccine as a gift, as you know, from last December, and it started by 50,000 doses of the vaccine.
Yes, Dr. Gamila, if you would allow me, there are medical plans and schedules for the inoculation process, and as you've correctly said, Sinopharm is one of the great partners here in Egypt, as they have conducted a lot of researches and common grounds on the vaccine itself.
Of course, you know that,
yes. Let's talk about the immunity period from your perspective in the plan of how long this inoculation process is going to take. There's 2 doses, the differences between them. This is all very new here at this stage here in Egypt. So there's possibly a plan that has to be administrated. Do you have any idea about it?
The plan, I think, that, as you know, that's just that I'm just putting the registration, but they are putting it in advance, the healthcare professionals to be the first to take the vaccine, of course, as we know, because they are prone to have infections. This is the first, and then comes the elderly population, then comes those who are having chronic diseases like diabetes, hypertension, and so on. So this is the plan of the government. As we can see, that, we have one from the British, the AstraZeneca, and then coming one who comes from Russia, and all our.
Gamila, my final question is statements from the health officials that Egypt has reached the peak of the second wave of this virus. Together, and it's the start of this pandemic on the medical, and I'm sure yet be inoculated at this stage. Has the protocol of medication changed, and has there been any differences since the start of the pandemic? The Egyptians who are affected.
Yes, you know, the different protocols, and maybe we have Egypt have changed the protocols maybe for 4 times. As we can see, the last protocol was issued in November. Last year, and actually this was amazing, and it was very good, and it was very fine. So we are adopting the last changes in the protocol in Egypt. And this is according to the latest guidelines. It's based on research and based on the latest experience from the second COVID-19 data.
Yes, very well. Professor Dr. Gamila Nasr, Professor of Cardiology at the
I'm head of cardiology
University and head of the
at
the medical school. Thank you.
Happy to share your perfect image of Egypt worldwide. Thank you very much.
Thank you very much, Dr. Gamila, for that. And wisdom moving forward with more news here. What's heading the news in Egypt during the past 24 hours? Egypt to disperse last tranche of the month.